Lucy, thank you very much. I'm not 105, but I am 88 years of age. And I'm so happy to announce that I am exercising regularly and working 50 and 60 hours a week. Minimal time, but I do want to talk about the importance of preventive medicine. Get here so I can see these slides. Because it is a whole lot cheaper and more effective to maintain good health beginning once it's lost. It's a whole lot cheaper to prevent disease than it is to try to cure it. We're going the wrong way, all the way. As she said, I did introduce aerobics to the world back in 1968. That was the first of 19 books we published over the last 50 years on trying the prevention of disease. When I was in medical school back in the 50s, we were taught that preventive medicine is the Cinderella of the medical specialties because there's no profit in health. The profit is only in disease. We established a tomb office and two employees back in 1950, and now have a marvelous 30-acre facility, 600 employees, and go to cooperaerobics.com. Bring it up on the website. You'll see what's happened there in Dallas. We're setting the standard for the world. All right, when I wrote my first book back in 1968, it was estimated we had less than 200,000 joggers at that time. In fact, I want you to know that I placed 101st in the Boston Marathon back in 1963. Sounds great. Only 150 people ran it back in those days. So I wasn't saying much. But then by 1990, we had some 30 million people jogging, and by 2017, we still have some 55.9 people jogging. Now, the critics in the early days said there'll be a passing fancy. People won't continue exercising, they'll all just wear out fairly fast. That didn't happen since going from 100,000 joggers to 55.9 million. But the critics said, too, the street's going to be full of dead joggers and more Americans follow Cooper. Well, was that right? Well, actually, from 1968 until 1990, heart disease didn't go up, it went down by 48%. And also, it's been documented in the literature that around the world, that heart disease has been going up. For example, in Russia, 31%, Poland, 36%, Hungary, 60%. I gave this presentation on the September 11th in New York City at United Nations. And I talked about the fact that we're leading the world now in lots of things, but also we've seen a decrease in longevity over the last 3 years, and we have an obesity epidemic that is unparalleled. Because the reason we had that 48% decrease during that period of time, I'll get this next slide to work, is that deaths from coronary heart disease, having difficulty here with this slide. If this next slide to come up, it would. Look at this carefully. Deaths from coronary heart disease and heart attacks and other consequences of clogged arteries peaked in 1968, the National Heart, Lung, Blood Institute says. The initial decline was so steep, it was hard for some scientists to believe it. After much debate, they decided that it was. All right, now look at that. We had only 33% of that decrease, 48% could be attributed to medical technology during that period of time, 67% because Americans changed their lifestyle. Who did? Baby boomers. 76 million people born between 1946 and 1964 led a health revolution we'd never seen before, nor have we seen since. All came to a standstill about 1990 with the onset of the obesity epidemic in America. Or what these baby boomers did, they quit smoking in great numbers. They got better control of their blood pressure. They started changing their diets. Middle-aged American male dropped his total cholesterol from 234 to 204 during that time. They learned the harmful effects of stress and how to control it, and they increased physical activity. Yet heart disease did drop precipitously, as you can see, from 1950 to 1960s, but it started stagnating over the last 5 years. And when is it stagnating? And we see heart disease just roars back. Younger people and women are most often stricken. Death rates of cardiovascular disease and heart disease and strokes has decreased only 4% since 2011 and greater than 70% since 2060 because obesity and diabetes are stalling the epidemic. I want to show you some very interesting studies from our longitudinal study. We have 150,000 patients in our database. We're in our 50th year with over 300,000 maximal performance treadmill stress tests and never had a death with stress testing. Yet in 1970, when I started my clinic in Dallas, I had to go before the Board of Censors because I was doing something as dangerous as maximal performance treadmill stress testing. I'd done 10,000 in the Air Force, a lot of experience. And this has broken through in the field of cardiology because back when we started back in the 60s, you couldn't monitor an EKG on an exercising subject. It wasn't possible. With development technology through NASA, we developed nice technology, which kind of introduced a whole field of cardiology, because we do treadmill stress testing to pick up early coronary disease. Because remember that the most common first symptom of severe heart disease is sudden death. Every week I have people come to my clinic, and I still practice medicine as I said, and we find, first of all, they have a coronary calcification score that's high. Next, abnormal stress test. Next, we do a CT angiogram at our clinic, the hospital the next day, angioplasty stent. That happens 4 or 5 times a week. And 54% of our patients are corporate-sponsored, and 74% are return patients, giving us a database of over 2 million person years of follow-up on those patients. That's the most classic longitudinal study in America, probably in the world. And it's not paid for by the government. We paid for it by ourselves. Our patients pay for the examination. We start to scratch and try to reproduce that database. It costs about $1 billion. We've done that without government support. I'm very proud of that. All right, in association, looking at our longitudinal study there, we've taken a group of 28,000 people and followed them for from 25 years. Now, 21% were women. We followed them to 65 to 75 years of age. Now, we looked at the level of fitness. The only thing we looked at, only variable, was their measured level of fitness by time on the treadmill. The top 40 percentile versus bottom 20 percentile. Didn't look at cholesterol, blood pressure, anything like that. All we looked at fitness measured objectively, not by questionnaire, by time on the treadmill. And then what we published, you can see the effect as far as Alzheimer's dementia. Those in that bottom category of fitness, about 25 years later, they had 36% more Alzheimer's and dementia than those in the top category. That's the only thing that's been shown to date that may reduce the frequency of Alzheimer's and dementia, and that's exercise. But something else, too, I'm very concerned about, and that is we're spending way too much time trying to find a cure for Alzheimer's. Over $260 billion has been trying to find a cure for Alzheimer's with no results. They look at the wrong thing. It's not tau protein the problem. It's not amyloid plaque the problem. It is inflammation that is the problem. Now, why is that so important? Because published at Harvard just recently, could inflammation be the cause of a myriad chronic condition? I think it can. You can have a full of plaque and tangles in the brain, but if you don't have something to inflame it, it's not going to cause the problems. So inflammation has to activate the plaque and the amyloid protein. So why don't we stop trying to prevent inflammation? Right now, why do those people that we followed for 25 years have less problems with Alzheimer's? Because we know that obesity is a major factor of metabolic inflammation. Our patients lose weight, get in shape. We've been able to document our studies that when people lose weight and get in shape using C-reactive protein, we can see inflammation does drop. So if the relationship between lifestyle, fitness, and reduction in inflammation, I think it's because they lost weight and they got in better shape, and it brought down metabolic inflammation. Oxidative stress, the things that can cause inflammation. Oxidative stress, pollution, smoking, sugar, refined carbohydrates, obesity, I said, and inactivity. Steps to prevent Alzheimer's, my recommendations are as follows. I follow these myself. Avoid inactivity. Collectively or sustained, get 30 minutes of activity most days per week. That's all it takes to move up 1 block on the fitness scale. 30 minutes sustained or continued activity most days of the week. Get 7 hours of sleep per night. Delay retirement. Socialize. We'll talk about isolation in a few minutes. I keep my vitamin D level above 50. I keep my B12 above 1,000. And I keep my omega-3 above 8%. I do feel that this is a major factor in preventing Alzheimer's and dementia, which I give to my patient. Another very important point from our data repository study. Look what happened. Those in the bottom category of fitness, those in the top category of fitness, their cost of health care from 65 to 75 years of age was 40% less. Can you tell me anything on the horizon has potential to reduce the cost of health care, what I told you? Just lifestyle. It has to be lifestyle. Other thing I pointed out in the presentation of the United Nations, that we can see prolongation of life if people just start concentrating on their lifestyle. There's a study you can see we published several years ago, back in 2009, showing that our people live longer. We had 29,000 women. We had 96,000 people total in the study, 58,000 men. And our men are averaging 87.5 years. I'm almost 89 now. Our women averaging 90.3 years. Because we try to get our people Cooperized. This is the maximum as far as lifestyle changing. Body mass index under 25. 5 is fine, 10 is better. Fruits and servings every day. Supplementation. as I do myself. Vitamin D, at least 2,000 units a day. Omega-3, 1,000 milligrams twice a day. No tobacco of any type. Maximum alcohol. No one should drink more than a drink a day. Lancet study last year showed 300,000 people for a period of many years. If the men drank 2 a day or 14 a week, they shorten the lifespan of 1.5 to 2 years. Alcohol increases the risk of cancer along with obesity. We know that. Stress control. I control stress by exercise at the end of the day before I go home at night. I work out before I go home. I meditate in the morning. Comprehensive examination. That's how to get Cooperized. Well, people say you can't prolong life. Look what the Harvard School of Public Health published with their study. Never smoking, healthy weight, regular physical activity, healthy diet, moderate alcohol. Nurses and professional studies, 5 for 34 years. If they had all 5 factors, look at that. The life expectancy was 93.1 years for women, 87.6 years for men. We can prove this now. The most underappreciated risk factor for physical and mental health known to man is lifestyle. And more than 76% of the diseases we have are preventable, and more than 45% of cancers are preventable. No drug can replicate the benefits of an active lifestyle. The way to solve problems is to empower the people, not empower the government. Will Hurd, U.S. House of Representative. Went through that very rapidly. I know she gave me 20 minutes, but I got only 10 minutes. I wanted to comment on something else. So I just got this recently from Harvard School of Public Health. And they talked about this whole subject of prevention and how we just don't spend any time. Just listen to these facts. They said that the war on cancer failed because it spent far too little on cancer prevention. The moonshot, MD Anderson, they're going to solve the problem with cancer. It's failed, hadn't done anything at all. Because we have in Texas a problem called the CPRIT, the Cancer Prevention Research Institute of Texas. It was funded by $3 billion over a period of 10 years, $300 million a year. The results have been nothing. Because, see, it's supposed to be cancer prevention, but they didn't spend any of that money on prevention. It was trying to find an early detection of cancer and treatment of cancer. It's all wrong, trying to get prevention. All right, there are many reasons why prevention research is unenticing. More societies are reactive, not proactive. The final phase of research on treatment is simply the research of prevention. We must concentrate on that. Too much care, too late. Yes, I'm very proud to be here today. I'm happy to say that in my advanced stage, I'm still exercising. I'm still traveling the world. We're all over the world now. We're starting facilities in China. We've had opportunity to be over there now several times over the past several years. I had a chance to visit with President Xi back in 2013, and he said the most fearful enemy to the health of Chinese children is their obesity. They've had a 9-fold increase in chronic diseases in one generation. Because they've accepted our American lifestyle, they have our American problems. What are they doing about it? They want to do something about it. That's why they've invited me to come over to work with them. I signed a contract in 2017 to Cooperize China by the year 2030. I'll be 99 years of age. My son was right with me. I'm telling you, folks, I have gotten nowhere in Washington in trying to get this concept of prevention into the politicians to accept this. But these are obvious things that we can prevent. If we can control metabolic obesity, if we control metabolic inflammation, by reducing obesity, increasing activity, the whole concept of health in America would change. But the thing we're lacking in America is discipline. We don't have a discipline to continue these things, whether it's our diet, our exercise, our medication, whatever it may be. I'm way out of time, I know, but I get carried away, I know. But I thank you all for listening to me, and God bless you, and I hope you gain from what I told you today. Thank you very much.